Hey y'all, I'm Robin. Hey, this video is about getting QMB. It's that Part B premium back in your Social Security, or how to get that extra money every month. I tell you all about it. I've been on it for 20 years, so I can give you tips and tricks on how to win it, what to do if you lose it and they stop taking money out of your Social Security. That's amazing. Or if they start taking the money out of your Social Security. I'll tell you what to do to qualify. I'll tell you the difference between Medicaid and this QMB program. Okay? Let's jump right in. This is QMB Medicaid, right? It's the Social Security Part B premium part. Right now in 2025, it's $185 a month. $2,200 a year, over $2,000 a year, folks. This is worth watching a video or going online and reading about it and applying. You know what? If you want me to send you I think it's like 12-page information, I'll send that to you. Just shoot me a comment, put in it, send me the goods or information or help. I'll know what you mean, and I'll send that to you. It's no big deal, because it can get a little complicated, but I'm trying to uncomplicate it for y'all, okay? It's Medicare Premium Assistance, or Medicaid Part B Premium, all right? A lot of folks get it in your Social Security. What is it? And I have notes, sorry. QMB is a qualified Medicare beneficiary, all right? Now, Part B, give you a quick on each part. Medicare Part A is hospitals, just the basics. Is if you stay in the hospital, Medicare Part A is the part that is supposed to pay for that. Most people don't pay a premium for that. You don't pay for that usually. Part A. Part B, like boy, Medicare Part B is for doctor's offices, outpatient medical supplies like nebulizers. It's not medical supplies like, you go to the drugstore or Walmart and buy Band-Aids or aspirin or something. Part B Medicare is about doctor's office visit cost, outpatient costs, medical supplies like nebulizers, or oxygen tanks, that kind of thing. Okay? And there's a premium for this, Part B, which means it's a monthly fee that almost everybody has to pay. If you don't pay it, then somebody else pays it. But somewhere along the lines pays this stinking monthly Part B premium. I'm going to tell you how to get that paid for you. All right. Now, Part C, Medicare Part C, is just like an extra little private insurance policy that you have on top of the original Medicare, right? So Part C is like Humana, Aetna, Blue Cross, United Healthcare is a big one. I think that's through AARP. I think that's who I have. I just switched. Anyway, Part D, like dog, Part D Medicare, that's the prescription costs. All right, I have a video on that if you want to watch how to lower your prescription costs. And it's some of the normal things, but it's some things I've learned over 20 years of being disabled on a lot of meds, right? If you want to save money on meds, watch that video of mine. That's pretty good. For instance, be nice to your pharmacist. Some pharmacists have coupons, right? I didn't know. Some of them do. Just kiss up to your pharmacist. Just be nice to them anyway, because they're way overworked and underpaid. But I'm just saying. One other real fast tip on prescriptions. Sometimes a prescription is cheaper if you pay cash for it, which means a couple of my scripts I don't put on my insurance. I'll tell the pharmacy, don't run that through insurance. Don't try and charge my insurance for that. Because here's what. These couple of prescriptions are cheaper if I just pay for them and don't run them on insurance. I know. Nothing makes sense anymore. Nothing makes sense anymore. I know. And it would make it. I have another prescription and I'll get off the prescription thing, but it doesn't make sense. Talk to your pharmacist, kiss up to them, be nice to them, because they know all the tips and tricks. But I have a script. It actually is less money per pill, if I have doc, if he writes it for double the milligram, double the dosage. Let's say it's a 10 milligram pill, and it has a slot in the middle, so you can cut them. That's what that means. If you have a pill that has a little slot down the middle of the pill, that usually, talk to your doctor, but usually that means you can cut it in half with a knife. So, oh my gosh, this medication, he just, instead of giving me a prescription for, 5 milligrams twice a day or whatever, he'll give me a prescription for a 10 milligram pill once a day, and I just know I cut it in half. And it costs a lot less. I know the 10 milligram, I don't know why, but the 10 milligram costs a lot less than the 5 milligram. It doesn't make sense. So honestly, if something doesn't make sense, I in my head, I'm thinking, oh, okay, I'm probably saving money. It's just the way it is. I'm telling you, I've been on Social Security Disability, I've been on Medicare, I've been on Medicaid, I've been on all these programs for 20 years, off and on. I switch because you got to stay up on this stuff. So that's why I'm doing this video series, kind of help you out. I have a video, subscribe or watch that video about saving money. I have learned so much over the years about saving money, how to save money on groceries, how to reduce my electric bill, how to get home improvement grants. I mean, 4 people in my neighborhood got new roofs off this one grant. I mean, and I know the trick. I'm going to tell you a little bit later. There's one trick, one tip I can give you for everything you fill out an application for that might get you, might be the difference between you getting whatever you're asking for and not getting it. Yeah, I know. Okay, here we go. All right. So QMB is a Part B premium. It helps pay your deductibles or your copays or your premium, right? QMB. I know it's a weird. QMB stands for Qualified Medicare Beneficiary. It allows your state. This is a state program. I know it's confusing, but QMB is a state program that pays for your Medicare Part B premium. Right now it's $185 a month. A couple thousand a year, we're talking. So listen up. All right. So these state programs, it's through your Medicaid office. Medicaid. All right. It gets a little complicated. I'm going to try and keep it simple. It is not, QMB is not a Part A. It's not a Part B. It's not a Part C or D. It's the premium. What you pay every month. Think of it as an insurance premium that you pay every month for the Part B. That's the doctor's offices, basically. Those costs, okay? It's kind of expensive. I mean, it's not for me because, I mean, it is, but, I mean, I go to a lot of specialists and things, so, sorry. Okay. Are you eligible? Are you eligible for QMB? You probably are if you're already enrolled in Parts A and B of Medicare. But there are also income limitations and asset requirements, meaning, you can't own a $100,000 car free, with no payments or anything. You can't own one outright and get this QMB. Come on, let's be serious, folks. You can't own your house outright. It's $200,000 asset. Asset just means it's something you own. That's all. It's just a fancy pants word for something you own. Asset. House, a car, whatever, scooter, boat, whatever. All right. So are you eligible? There are income limits, which I'm going to tell you in a minute. There are asset limits. There's co-insurance costs. If somebody else, if you're getting this Part B premium paid by another government entity, like whatever, if there's some kind of other agency who pays your Part B premium, they're not going to pay it twice. And they're going to find out. Let's be honest, folks. Just be honest, because listen, these government agencies, they all know each other's business. So you can't put down that you don't get Social Security, or, oh, I forgot, I get whatever, $1,000 a month from Social Security, or, oh, I forgot I have $20,000 in my checking account. No. First of all, they're going to ask for proof of anything you send in with your application that you say. They're going to ask for a list of your prescriptions. That, just have your pharmacist print it off for you. Hey, what prescriptions did I get this year? What did I get last year? It's not that difficult. You don't need to get, hopefully you go to the same pharmacist. I learned that the hard way. Go to the same pharmacist for all of your meds, because, some meds don't like other meds. That's not good. So get all your meds at one pharmacist. Make sure that your one doctor, your general practitioner, your general doctor, the one you go to for everything that sends you to specialists, make sure they know what medications you're on. If some other doctor out of their network gives you a new medication, make sure your doctor knows about it. Just saying. All right. So here's the monthly income limits. Are you ready? Hopefully you've got a pen and paper, because I'm going to give you some phone numbers and websites, or like this, income limits. You might want to write down. All right. Share this video with someone you know, because I'm betting you have a neighbor, an elderly person at church, a friend, somebody who needs to know this. Get them $185 a month in their account. They might, buy you a beer, buy you lunch, whatever. Woke you up there, didn't I? Buy you a beer. I don't drink. Anyway, so the monthly income limits. A single person, and mind you, this is Indiana. I'm going to give you the phone number to call, because it changes every year or two, usually, and it's different in each state, especially Alaska and Hawaii. Those are higher limits. Because y'all, I wish I lived in those states. Y'all, God bless you. All right. So the income limit, single person, $15,060 a year. Got it? Two people, ready? Two people for the QMB benefit to go on your Social Security. Two people, a couple. The income limit is $20,440 a year. Now, I don't know what year you're watching this video, and I don't know what state you're in. So call the numbers I'm going to give you. I'll go online and check it out in your state and in the year that you're in, that you're watching this. Okay? You might still be eligible. There's this, I'm just going to mention it quick. There's this $20 disregard. I don't know what the heck it is. Don't even worry about it. But you'll see a $20 disregard is subtracted. I have an idea. Just don't worry about it. All right. So this is 2025, Indiana. I'm going to tell you where to go. Now, who qualifies? Who qualifies for QMB? I'm going to tell you. People who are on a Medicare Advantage plan. If you're on one, you'll know it. All right? You'll know it. It's the plan with Part B that has the doctors or outpatient. That Part B, Medicare Part B, has the give back benefit. All right? I know, it gets a little weird. So QMB, who qualifies? people who have a Medicare Advantage, people who have the give back benefit in their insurance, and the Medicare, all right? You must be in Part A and B Medicare to get this. I mean, obviously, because it's QMB, it's the Part B Medicare premium. You have to be paying that premium before you can get it back. That's how it works, folks. I know. Does it make a little more sense? Yeah. All right. So, and you have to be paying your own Part B premium, and you have to live in an area that has that give back benefit. Some areas, and again, I'm going to give you phone numbers and all to check out your state, your area, all that good stuff to find out. But these are kind of the basics of the program, okay? It's the QMB income limit is usually based on the federal poverty line or limit, FPL, all right, every year. So what that means, that FPL, the federal poverty line, I have trouble speaking sometimes, FPL, federal poverty line. You'll want to know what that is every year, because a lot of these programs are based off that number. And what that is, when the census comes around, census, they count how many people there are, and they ask you what your income is, census, CENSUS. So what they do, they will count the number of people in whatever U.S., and they'll do an average of the income, and they'll figure out, I don't know what the formula is, but they'll figure out what the federal poverty level is. It's an income number, right? And so a lot of these state programs, your Medicaid programs, this QMB program is based on if you're below that federal poverty level for income. And yes, they count Social Security as income. I know, we earned it years ago. Hey, you're preaching to the choir. I know, I'm just saying, okay? And then they also have income limits, and then they have limits on what they call non-exempt property. Like I said, you can't own a $200,000 house and not have any mortgage payments and own it outright and expect to get this $185 in your Social Security every month. That's just not how it works. Okay. So you have to be in Medicaid and Medicare. Now, listen, that doesn't mean that you have all of the Medicaid programs. Here's what. I get just this program from Medicaid, the QMB benefit. Medicaid only puts in my Social Security this $185 every month. I don't get food stamps. I don't qualify for that, for income. I don't get TANF, SNAP, none of that. I don't get any of that. I only get this one benefit from Medicaid. So when I say you have to Medicaid or Medicare, that doesn't mean that you are eligible for food stamps or TANF or any of that, right? This is the only program I get benefits from on Medicaid is this QMB, the Medicare Premium Assistance Program. All right? You just have to have one benefit. You just basically have to have a case open, or not open, but you have to have a Medicaid number. Let's put it that way. If you have a Medicaid number, which means you have something with Medicaid and Medicare, you're probably going to be enrolled in this QMB, all right? How does it work? It pays the payments on Part A, Part B premiums, your annual deductibles. It might pay insurance co-payments. What it means when you get health care is that a doctor, a hospital, whoever, they should not be billing you any approved care under Parts A or B. Let me say that again, because this is important. And if you feel like you're being charged, if you feel if you have this QMB and you're being charged for parts A or B, which means in hospital stays or doctors, outpatients, call 1-800 Medicare and check it out. You might be being charged when you shouldn't. All right. There should be no major exceptions to this. Sometimes with everything in the government, there are exceptions. I feel like I need to be a lawyer right now and say something like everything I tell you could, how do they say that, is subject to change. Who knows what's going to happen in the next 5 minutes in this world? I mean, I'm just giving the scoop on what I know from 20 years. 20 years of being disabled and getting this QMB, this Social Security Part B premium assistance in my Social Security. I'm just telling you what I know. I'm going to tell you later, too. They just stopped. They just took out this $185 one month. It scared the heck out of me because, you know, you get your deposit of your Social Security and holy cow, it's $185 short. Well, I knew exactly what program it was with because it was exactly $185. So I got on top of that. Called them, appealed, I won. I'll tell you about that in a minute. Okay, here's the how to apply. You ready? Hopefully you have a pen and paper. I'm going to sit here and look like a nitwit for a minute. Got a pen and paper? Got it? Okay. Your Medicaid office. Medicaid, this is your state Medicaid office. What you do is you go to you go online, or you Google, or you go to the library. They'll help you out there. And you, whatever state you're in. So for instance, I'm in Indiana. So the abbreviation for Indiana is IN. So I go to in.gov, G-O-V, /Medicaid. That's that backward slash thing. I know, I'm old. Okay, so if you want to find your Medicaid information, the office, the website, the phone number, their hours, all that good stuff, type in your state abbreviation, mine is IN, then you type in dot or period, gov, G-O-V, backward slash Medicaid. Or if you're looking for this QMB specifically, this one you type in your state, in.gov /QMB. It's easy. If you're looking for extra help, it's pretty much everything is / whatever you're looking for. And it should bring that up. It should even bring up your application that you need. All right? Medicaid SHIP. SHIP is another, it's a state health insurance assistance program. SHIP for short. I know. Hopefully I'm helping y'all. Like this video if you learned anything from all my rambling. SHIP is another way to get someone who isn't part of an insurance agency or anything like that, someone to give you guidance or counsel you on all this Medicaid, Medicare, all this health care stuff, right? And usually, I mean, it's always free. And what you do is you get a hold of SHIP, right? Just Google SHIP or go to the library, tell them you want to get in contact with your SHIP, SHIP person in your area and make an appointment. And you go see them. It's pretty cool. What you'll need when you go there is a list of your prescriptions. All right? So get that from your pharmacy. Print that off. You should have that anyway. Just keep it in your purse or your wallet, a list of prescriptions. All right? Okay. So it's SHIP. It's called the State Health Insurance Program. I know. I know. I know. I know. I know. All right. Here's what else. Okay. Here's what else. Sorry. If you're using a Medigap plan, those premiums are not covered. Just for your information. All right. Once again, if you just want info, just type in something like help or send me the goods and I'll send it to you. Okay? So you have your income that you have. If you start working, you must let them know. Like with any government entity. Okay? If you're disabled, once you get your Social Security award letter, you're automatically enrolled in Medicare, usually 2 years after you've been disabled. Now, what you'll pay for is about $4.80 for each covered prescription drug. All right? Who knows what that is? It could change. Some of the other questions asked, can you get Medicare and Medicaid at the same time? Yes. Most people do. I do. Can you get a Medicare? Can a Medicare provider refuse to see a QMB patient? No. Let me tell you again. If you're getting the QMB benefit, the Part B Medicare benefit, they cannot refuse to see you. And that's according to the Centers for Medicare and Medicaid. Healthcare professionals cannot refuse to see you just because you have a QMB. Does QMB cover dental? No. Remember, QMB is the doctors, the outpatient, but not dentist and vision. That's not QMB. QMB is the Part B premium. Okay? You can get extra dental insurance with your original Medicare, but that's on your Part C. Look for that video. Let me know if you have any of this stuff and what you think about it all. I know. Okay. Does everyone pay the Part B premium, that $185? No. Not everybody. It's based on your income. Okay? It's based on your income. Now, the next question. How do you prove you have QMB? You call 1-800-MEDICARE and ask them, do I have QMB? Does Medicaid, does anybody pay my Part B premium? Especially if you have it put into your Social Security and then all of a sudden that money's not put in your Social Security. Call Medicare. You'll get a notice from them telling you if you want it, if you got it. Okay, so keep that notice. Take copies. Let's see what else we got. Other questions. Why is Social Security not paying Part B, the QMB, anymore? And here's what. That happened to me. And that's scary. That's really scary. If you get your Social Security direct deposited every month, and all of a sudden, 1 month, you look in your bank, you know, because everybody, if you're on Social Security, you know exactly what day you get paid, and you're looking to make sure you got paid, that you got that money before you go grocery shopping. And that's scary when all of a sudden, you know, my Social Security was $185 short. What the? Yeah. So you get in touch with them right away. Don't just take that baloney. No, because they make mistakes. They make mistakes. Changes on income, eligibility, they all change with all these programs. Sometimes you'll just stop getting that $185 in your Social Security for, I mean, there could be a lot of reasons. Maybe the income limits have changed. You know, it's a new year, and maybe they've changed. Which, by the way, when we get that COLA every year, that COLA, the cost of living increase that we normally get for inflation every year in our Social Security, don't worry so much about that when that comes, that it might put you over the limit for these programs, income limits, because here's what they'll usually up those limits after a month or two, and it'll be okay. You won't, don't get freaked out if that COLA increase, that inflation increase in your Social Security takes you whatever, $50 over the limit for these government programs. Don't worry about that so much. I mean, keep an eye on it. Keep an eye on it. Make sure you're not getting notices that you're over the limits. But they'll usually adjust their income limits for that COLA, for that yearly increase in Social Security. Okay, I'm just saying, don't freak out over it, but keep an eye on it. Also, if you lose your Social Security benefits, of course, they'll stop paying this. It's just the way it is. Look into it. How do you appeal or contact if there's a possible error, or you just like want to know what the heck's going on? Just want to check on it. Don't get mad at anybody, okay? That's the worst thing you can do. They're people just like us. You get mad at them, good luck getting what you need. Call 1-800-MEDICARE, 800-633-4227. Is Extra Help QMB the same thing? No. QMB is the Part B premium. It's the premium. It's the monthly fee for that Medicare Part B. Got it? That's what QMB is. Extra Help program is for prescriptions. That's kind of the main difference, all right? Extra Help is for that Part D Medicare, the prescription drug costs, all right? Watch my video on the Medicare. That'll explain. I mean, maybe if you watch, hopefully I explain this as much as I could. It's it's the government. They try and confuse us, I think. There's so many. I mean, now they're getting rid of a lot of government agencies, but it's a lot of help, right? It's a lot of help, but it can get really confusing. If you are eligible for this QMB, apply for it. It's a great amount of money for just a little bit of, an hour or two of time, filling out the application, looking to see if you are eligible for your income or your assets. It's worth it. Just do it, okay? Hopefully, please subscribe. Like this video if I helped you at all. If you learned even one thing, I'd appreciate it. I do put a lot of work into them, because if I didn't, I would just go on for hours telling you all these stories about all the stuff all these programs. So hopefully this will help you out. This video was about the QMB, getting that premium back in your Social Security, and what to do if they stop giving it to you. All right. Hopefully it helped. Thanks so much for watching. Love y'all. Bye-bye.